So now I want to change a little bit of this imaging in a practical aspect. So for applications, so we want to measure the heart dysfunction, especially if there's a myocardial infarction. I want to find out if there's any lesion which is underperfused area of the heart. The problem of the heart is our heart, you know, it beats all the time, and imaging this beating heart is very challenging. So we need to devise a smart ways of knowing the heart beating. Then this beating heart is dynamic. So we developed ways to take picture. It's very short, but it's a snapshot of each of different phases of the heart. The thing, it's dynamic. The thing is, it is a periodic. So that's what we call as a gating, and we can use our technique called ECG to exactly know the status of the heart beating. So this is a diagram that we use ECG, then we can see the periodic motion of the heart, and we can divide this heart into a number. In this case, maybe 8 times of time interval. Then we take picture at this phase. But we do know about from the ECG each of these repeating times. So each picture may not have high signal, but we can accumulate this, let's say R1, R2, R3. When there's a QRS complex will indicate the same phase, we just add them up and we have a higher signal, and we are using this to a snapshot of this status and the second one, and so likewise. So it combined those gated images. So that we call this technique as cardiac gating. It's an image process, can be synthesized with the patient's own heart rhythm by using ECG to prevent blurring. Because if we expose all this time, the heart is moving and it will be very blurry. So this is a very smart algorithm to be used for both SPECT and PET, and information about the organ size. Now we have a good resolution, relatively, shape, position, and irregularities can be detected. So for example, liver abnormalities or abscesses or lesions, we can find a hepatitis or cirrhosis. Okay, if there's an enlarged spleen or splenomegaly, then we can see that indicates an infection. Or brain, we can measure blood flow or metabolism, and even neurotransmitter binding, which is a functional imaging. So with this development, in fact, this technology or idea can be also used for another area. For example, optical imaging. Using optical endoscopy to image the heart is very challenging for the same reason. So we borrowed the idea from here for endoscopy of the heart. If there's an animal, so it's a tiny heart, but it's a beating heart, then an animal is also breathing as well. So all this one, we can use that idea into intravital microscopy. So here I have an example that the animal has on a ventilator, so we can control the breathing rate, and the lung airway pressure gives a relatively flat part. We can use it for imaging. Here, inspirational gating window, and at the same time, the heartbeat itself. So there's a PQRS, T interval, and you can find out the relatively stationary part of the heart beating, so that it allows us for imaging. So that we call cardiac gating window. And both of this inspiration and cardiac gating meet that segment, a gating window, which allows us to a stable stationary imaging. And over time, we can accumulate for high signal to noise ratio imaging. So that was published in 2011 in Nature Methods. So you see, one part of the nice trick or technique can be used for another part. So now I give you another example. The problem of PET is it has an extremely high sensitivity and specificity, while it does provide a little poorer anatomical structure. So that's why PET can be combined with another more structural image such as CT or MR, and that gives us a better view of what's going on in the body. So here I put some examples of MRI and the PET imaging. We can combine them together so that on overlaying under the structural anatomy, we can overlay the metabolic activity. So for example, a thyroid image is a first routine clinical application by use of the property of iodine which accumulate in the thyroid. So we use 131 iodine to detect the thyroid cancer and to evaluate whether there's over or underactive thyroid activity. And heart and brain as well, because they are always very, very high metabolic activity. So location of damage caused by in the heart case, heart attack or stroke for the brain, it can be imaged by using PET and maybe MR together. And bone scan is also another good example. Bone growth, fracture, and tumor in the bone and infection can be visualized because that metabolic activity is increased, which means inside the bone there could be a tumor growth or there's a fracture. While on the other hand, if that particular area of the bone has shown decreased activity, that may be meaning that location of damage or restriction of blood flow. Okay.